Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey everyone, I'm Dr. Burton, the host and creator of the Dr. Mama Says podcast. Thanks so much for choosing to join me today. As a pediatric ENT physician, I regularly see patients who are not speaking the way they're expected to speak or the way others think that they're supposed to speak. This doesn't mean there's a problem, but an evaluation might possibly be needed. Today's episode of the Dr. Mama Says podcast will share a discussion about toddler speech delay. This is to try to help parents to begin to think about their child's speech in a little bit of a different way. First of all, I have to remind you that this is a physician's perspective. And I'm not a pediatrician or a family practitioner, both of whom have a lot more experience in this area, but I'm a surgeon, an ear, nose, and throat surgeon. Nevertheless, I see more than my fair share of toddler speech delay, so I feel that my input is important too. Many times when patients are referred to me, there's a concern that perhaps the child has some type of a hearing loss and that this may be impacting their speech. And of course, I see the kids that have chronic ear infections and allergies, both of which can lead to off and on hearing loss and can lead to a long-term toddler speech delay. I've discussed those medical problems in detail in several other podcasts, and you can check out the show notes to find links to go back and review them if you'd like. When people have trouble with speech, they typically see a speech therapist. Those are the specialists that work in this area. But full disclosure, they work on more than just speech. So their real name is speech language pathologist, or SLP. Most people will still say speech therapist, so I'll use this term. It's just like when people say ENT instead of my official specialty name of otolaryngology. We all know what we're saying. In fact, what did Shakespeare say? A rose by any other name is still a rose. Anyway, physicians are not speech therapists, so we tend to look at things a little bit different. Before I highlight some of the things that I think are important for parents to know about toddler speech delay, let's all get on the same page about why it's so important. So what are some of the long-term consequences of having a toddler speech delay? This is a problem that's really common. If you look it up, there's wide ranges of what people consider, but somewhere between 5 to 10% of young kids have some type of a speech delay. When this comes up and parents notice a child whose speech isn't quite what they expect, many people default to the classic answer of, well, it's just a childhood problem and my child's going to outgrow it. But my question is at what point do you finally decide that the delay is not just a normal variation? Like all kids don't walk at age 1. Some kids are running at 9 months. Some are still trying to stand up at 15 months. Having a normal range is an important thing to understand. Parents will say they're trying not to compare kids. They don't try to compare their own kids. They try not to compare kids to other kids that they see. But in reality, comparing is normal. That's how we decide what's the bulk of kids fall within a range for any milestone. So this is the purpose of this episode, to discuss why it's important to know if there is a toddler speech delay and your child is outside of that normal range. Now, what are some of the consequences that happen if a toddler speech delay is not found, not addressed, and not worked on? Kids between the ages of 2 and 5 that have a speech delay, they go on and have a little bit more of a difficult time learning to read. If they have a speech delay that continues on after age 5, there's a greater chance of having attention and social problems. Some speech and language problems that continue on between ages 7 and 13 can lead to reduced writing skills with more trouble with spelling and punctuation. Basically, even after intensive speech therapy, there can be some negative long-term educational achievement problems. Many times when I evaluate patients with this speech problem, parents are actually confused about whether they actually think it's a real problem or not. But as an ENT doctor, I can tell you that by the time I'm concerned about it, it's pretty significant. I don't pick up on the mild delays that primary care or speech therapists might, so keep in mind that the things that I'm going to be discussing, they're coming to you from a different perspective. Kids do develop speech at their own pace, but there are some signs that parents can watch out for to determine if they're on the right pace. There are some important minimal guidelines that let us know if this is something that's going to fix itself or something that might need to be addressed. So first, what is speech delay compared to language delay? Are they the same thing? Nope, they certainly are not. These are two completely different things that have different meanings, but many people use speech and language delay interchangeably. It's a good idea to know the difference. Basically, a speech delay is a sound disorder where kids have trouble pronouncing the sounds in the words. This can make their speech harder to understand. A language delay occurs when kids have trouble understanding the words or trouble forming sentences or even trouble just communicating their words or ideas. Speech and language problems can happen separately or together, meaning there are some kids who have trouble articulating the words or pronouncing words, but they're really good at understanding the words and forming their sentences. And on the other hand, there are kids who articulate very, very well, but they struggle to understand what you're saying to them. They struggle to form their own sentences and to express their feelings. Another way to describe these differences is that speech is the actual production of words, while language is the processing of communication. So taking that one step further, language actually has two parts. There's the receptive speech, which is the understanding, and the expressive speech, which is the ability to share that information. There are many parents who talk about their child with a speech problem, and they go, but they're really, really smart. They understand everything I say. That's receptive language. Other kids are very good at expressing themselves, but the words aren't very sharp. Speech, articulation issues, language, expressing yourself. All of these have different things. You don't have to know the difference. You just have to know what concerns you have, and when you share them with your healthcare providers, they'll be able to figure out what needs to be happening next. And on a side note, voice problems are a completely different animal. Voice disorders are medical conditions that do affect the production of speech, but trust me when I say that's a whole category all onto its own. Another common area of confusion for parents is the question about how learning more than one language can influence toddler speech delay. But kids who grow up learning 2 or more languages often just have a difficult time because there's some amount of mixing the 2 languages together. For instance, I'll share with you what I hear in my office with some of my bilingual kids. Bear with me as I do not speak very good Spanish, but kids will say things like, I want agua. Clearly, they want water, which maybe you didn't know, but my agua, that's water. This sentence is pretty straightforward. They took an English word and a Spanish word and put it together. But some languages put the adjectives in different places. Like when we say red truck, in Spanish, we put the red after the word truck. So when a child says, want truck rojo, okay, there's my Spanish, rojo, meaning red. The child wants the red truck. But in English, we are saying red truck. And then when they put the rojo after the truck, it's a difficult way to understand. So when you get lots of sentences jumbled together, alternating words and misplacing the words, yes, it's very difficult to understand. But usually as time passes, their language skills begin to improve and the problems go away. Most bilingual or trilingual, yes, I've got a good number of kids learning 3 languages at the same time, they become usually fluent in all of their languages by age 5 or 6. These kids usually do not have articulation problems. They simply repeat the words that they hear and they have trouble sorting out when they should pull in which word. I always ask parents if their child says each word correctly. It is more concerning if the child calls a hot dog a dog, because that is not a word in anybody's language. If you add misarticulation on top of grammar and mixed languages, this can be a much bigger problem to sort out. You have to remember that bilingual kids can have the same speech and language problems that other kids who only speak one language can also have. So keep in mind a referral to the speech and language pathologist should still follow the same criteria as the kids who speak only one language. So what should parents expect when they actually go and talk to a physician about speech concerns? I've learned that over the years, parents are generally very, very proud of every accomplishment that our kids do. I remember staring at my babies, trying to decide if that's a real smile or just some gas. Was she trying to roll over or just wiggling around? So if I looked at these things in my kids and gave them points for that, then when my pediatrician asks me if something is there, I'm going to say, oh yes, they're doing that. Yes, it's a subject to interpretation, but generally parents, we err on the side of, yes, my child can do that. With that said, when a parent shares with me that maybe there's some speech concerns, I give that a lot of credit because we don't want to say that. We don't want to say something's wrong. So I feel that if they brought it up, I need to look into it. And by look into it, I mean spending more time getting parents to share what they've noticed. I'm not big on saying this child is young so it will go away. I always get more clarification. I often ask more questions that parents are often not ready to answer. So if you bring it up, you should be prepared to talk about it. Some of the questions that I routinely ask during my speech evaluations in my office are, is your child talking and you just don't understand? Lots of kids just jabber away. They walk right up to me babbling all kinds of stuff, and they end with a sentence that sounds like they're clearly asking me a question. That's some really good language. They are interacting, they're looking at me, they're talking. I just have no idea what those words are. I also ask parents, do you understand your child but others don't? Many parents will say to me up front, oh no, my child's speech is great. This is often the case when parents come for another reason. You come because of allergies or ear infections, so your real problem wasn't speech delay, but I'm just asking. So no, parents haven't noticed it. It hasn't reached their radar of being a problem. But often I will sit there and witness toddlers talking to parents. They go back and forth, and I sit there and I understand almost none of what that child is saying. I only know what's going on because of the parent's response. I also will notice that some of these parents have a pattern of repeating what the child says and then moving forward. This kind of suggests that you're struggling to understand what your child is saying and you're verifying their words. For instance, if I said to you, I want to go to the store, you would not normally respond with me, the store, and then reply, yes, I want to go to the store. You generally, if I said you want to go to the store, you say yes. But many times when parents heard the word the store, they would ask the store, and then the child would say something else, and the parents goes, oh, you want some more. This is really a guessing game, which means you kind of are trying to figure out what they're saying. When I point this out, parents often don't even realize that they are trying to guess and figure out what their child is saying. The speech is not sharp. You don't understand the words. Another question I ask, is your child attempting to talk, or is your child mostly crying, gesturing, pointing? Many times, this is the case, and sometimes it's been that way from the beginning. They never really articulated any words. But other times, parents will report the child used to talk a lot more, but now mostly gestures and does things themselves. Kids don't ask you for the book anymore. They take the chair, they pull it across the room, they climb up and get the book off the shelf. They can work a DVD player. They walk into your purse, they grab the iPhone, they can work some electronics, but at no point is there any conversation. Sometimes this happened because they used to ask you for it and you didn't understand it, so they just figured out it's quicker for me to go do it myself. And some final questions I ask is, does your child understand what you say to them? Or are there any other developmental delays? Or when was the last time your child had a hearing test? Another point that I want to talk to you about is that it's really important for physicians and speech therapists to actually hear your child speaking. But many kids come to the office and they refuse to speak during the visit. Or they speak in a way that's really frustrating to parents because they're saying, this is not how they talk at home. We can only judge what we are hearing in the office. So when parents try to mimic the sound to let us know what their concern is, that is not as good as actually hearing the child. So if your child is shy or doesn't want to speak or whatever the problem is, there's something that I have actually recommended to parents to try to work to find a way to help prepare kids to have some communication, some talking, so that it can be witnessed by the healthcare team. Watching kids move their lips and tongue is an important part of the evaluation. One thing I started having parents do, and I started doing this many, many years ago, and I'm going to share it with you now. If you're a speech therapist listening to this, I apologize if this is not something you recommend, but I'm just saying at my level, I'm trying to get some type of information that's useful to figure out what's going on. I don't want to refer a child for a speech evaluation. I don't want to refer the child for a speech evaluation without me doing my own evaluation first. That would be like the pediatrician referring a patient to me because mom says the child has large tonsils. If the pediatrician hasn't seen the large tonsils, it's really not something that they should refer on. So here's my little technique. I've told parents who may have these kids that aren't going to be talking to start a ritual where they pick out the same picture book each night and they read it after dinner. It can be colors, animals, whatever you want it to be. The parent and child read it every night. The child points to it, says the words. After the book is done, there's a treat. Yep, I'm that kind of mom. I've rewarded success in my kids and they learn to work for success. That can be a whole nother conversation about parenting styles, but kids learn from repetition. So anyway, once this nightly reading routine has happened, the child comes back to the office, whether it's for anything, they are there, and if the child is not engaged, if the parent whips out this book, the child knows what that is. They grab that book, they start pointing, and as they're going through, they're like red, green, blue. They're naming their stuff because they know there's a treat. That is actually very good because we get to hear the sounds. Even though the child is not actually having a conversation, they're not expressing themselves, some of the important aspects of speech are able to be assessed. There are kids who speak like a ventriloquist. They do not move their lips at all. There are kids that as they're talking, their tongue is sticking out a lot. So there's a lot of tongue thrust. There's some tongue issues. There's tongue tie. They cannot elevate the top of the tongue. Or there's kids who don't speak with the back of the throat. So it's almost like they've got a cleft palate where air is escaping. So like instead of saying cake or Coca-Cola, they say hake or Hoka-Hola. So hearing those sounds is very, very important. So when should parents become concerned about a toddler speech delay? There are many ways to assess speech in kids, and there's no one factor that makes the diagnosis. If you Google speech delay, you'll be bombarded with excellent resources and tables about all the appropriate milestones. I'm so looking forward to me getting over my concerns about my podcasting editing failures so that I can bring on some experienced physicians and healthcare providers to share some of their specialty from their approaches. I'm getting closer. I'm hoping to be able to bring some experienced speech therapists to join in and share some additional tips for you. But anyway, when milestones are suggested, it's usually an average, not an absolute number. I will share an easy way to spot clear-cut toddler speech delay. This is not an average number, but instead, these are values that are way out of bounds. These are sort of the minimum levels that should happen at this age. If your child is not reaching these, you should definitely be speaking to your child's pediatrician about it. And these are just simple facts. These are delays, and it's not weighing factors like the child's a boy, or there's older siblings, or the child was premature, or is a multiple birth, a twin, or a triplet. Yes, those factors are important, but the values that I'm telling you, they should be met by everybody. And one of the reasons that I say this is because it can be hard for parents to count the number of words. I know I struggled to count my kids' words. I didn't know, should I count the ones that I understood or the ones that were actually spoken correct? So the technique that I tell parents is these are the minimum levels. It's something that I call the 1, 2, 3 rule. Between the ages of 1 and 2, a child should say at least one word other than mama and dada. Some people say 20 words. Again, not sure how you count them, but there should be one clear word. Between the ages of 2 and 3, kids should put 2 words together. Daddy sit, mommy bye-bye, go home. Some people say 50 words. I don't know about you. Counting 50 words is a lot. But is your child parroting and putting 2 words together? And after age 3, kids should have 3 words in a sentence. These are minimums. If you have a 3-year-old who's saying mommy, daddy, home, that is way outside of bounds. So these are things that if this is happening, talk to your child's physician soon. It may not be possible to prevent all speech and language delays. Hearing problems and learning disabilities may not be preventable. These are things parents can do on a daily basis, such as talk to your child from the time they're born. Using regular words. You don't need to talk baby talk. Regular words. Let them hear them. Learn the cadence of your voice and repeat the words. Respond to your child's babbling even when they're a baby. This is showing how conversation is. They babble, you answer them. They babble, that's a conversation. Sing to your child even when they're a baby. Yes, I still laugh at my lovely singing voice. I used to sing the Beatles song, Close Your Eyes and I'll Kiss You. Each night, every time I put my kids to bed, not the classic lullaby, but hey, parenting has no real rules. Also read aloud to your child. As my kids got older, I had them reading to each other. Answer your child's questions. Yes, that constant why. This is so important for you to have that. When kids see me, again, they typically need a hearing test and an evaluation to make sure there's not a physical problem that may need some surgery. But just like all things in medicine, there are usually many factors, so it's important to keep all of this in mind. I am hopeful that this podcast has helped some parents to relook and rethink about how they're viewing their toddler's speech. If you have any concerns, please speak to your child's physician and work together to determine if a formal speech evaluation is needed. So I think that this is a good place to stop. So that's it for today. For now, I gotta go. Thanks so much for joining, and I hope you come back and check out another episode soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to iTunes and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in this episode, a summary of the show can be found on www.drmamasays.com. And don't forget to subscribe. Hope you come back and listen again soon.